Physical Education, Quarter 1, Module 2. Sports Officiating, Basic First Aid. Basic First Aid. First aid is an immediate and temporary care given to a person who has been injured or suddenly taken ill. It includes self-help and home care if medical assistance is not available or delayed. Common injury encountered by officiating officials and athletes. Sprains. A sprain is caused by torn fibers in a ligament. Swelling and bruising are some signs and symptoms. Basic first aid for sprain. Remove any clothing or jewelry around the joint. Apply cold compress at once. Elevate the affected joint. And the victim's physician may recommend an over-the-counter anti-inflammatory medication like aspirin, ibuprofen, which is appropriate for the victim's general health.
Of injuries to the 3 ligaments on the outside of your ankle. Ligaments are tough bands of tissue that stabilize joints and help prevent excessive movement. An ankle sprain occurs when you roll, twist, or turn your ankle in an awkward way. This can stretch or tear the ligaments that help hold your ankle bones together.
Common injury encountered by officiating officials and athletes. Heat exhaustion. Heat exhaustion is a response to heat characterized by fatigue, weakness, and collapse due to inadequate intake of water to compensate for loss of fluids during sweating. Basic first aid for heat exhaustion. Have the victim lie down with his or her feet elevated. Keep the victim cool. Give him or her electrolyte beverages to sip or make a salted drink. Monitor the victim for signs and shock. If the victim starts having seizures, protect him or her from injury and give first aid for convulsions. If the victim loses consciousness, give first aid for unconsciousness. Other serious injuries that require immediate care of first aid include strains. A strain is a twist, pull, or tear of a muscle tendon, a cord of tissue connecting muscle to the bone. It is an acute, non-contact injury that results from overstretching or overcontraction. Other serious injuries that require immediate care of first aid include knee injuries. Knee injuries can range from mild to severe. Less severe would be tendinitis, patellofemoral compression syndrome, iliotibial band syndrome, and bursitis, to name a few. More severe injuries include bone bruises or damage to the cartilage or ligaments. Major injuries are common to the anterior cruciate ligament or ACL and the lateral collateral ligament or LCL. Knee injuries can result from a blow or twist to the knee, from improper landing after a jump, or from running too hard, too much, or without proper warm-up. Other serious injuries that require immediate care of first aid include fracture. A fracture is a break in the bone that can occur from either a quick one-time injury to the bone or acute fracture, or from repeated stress to the bone over time, or stress fracture. Other serious injuries that require immediate care of first aid include dislocations. When the two bones that come together to form a joint become separated, the joint is described as being dislocated.
So, what is a dislocation? A dislocation occurs when the bones in a joint separate. A joint is where two or more bones meet. Dislocations can only occur to joints. You can sustain dislocations in any joint of the body, but the more common sites of dislocation include the shoulder, hip, patella, ankle, and finger. Dislocations can occur because of anatomical issues or blunt force trauma. A person's anatomical structure can play a role in how easily and how often he or she might sustain a dislocation injury. By nature, some people have weak anatomy, meaning the ligaments that hold joints together might not be tight enough to physically hold the joints together. This is also true of someone who has received multiple injuries to the same anatomy or joint. What exactly does this mean? It means that a person can dislocate a joint just because he was born with loose joints.
R.I.C.E. method. Rest the injured part, especially for the first 24 to 48 hours after the injury. This is the most critical time of treatment. Avoid any activity that causes pain or makes it worse. Use crutches if the leg, foot, or ankle is injured. Support an injured wrist, arm, or shoulder with a sling. Tape an injured toe or finger to its healthy neighbor. Ice is an excellent anti-inflammatory and reduces swelling and pain. Apply an ice pack or cold compress for 10 to 15 minutes as soon as possible after an injury. Repeat each hour for 3 to 4 hours, then 4 times a day for the next 2 to 3 days. Protect your skin with a thin cloth. If ice pack is not available, a packet of frozen vegetables in a cloth will do. Compression also reduces swelling. Use elastic bandages for at least 2 days. Check that the bandage is snug but not too tight. Take the bandage off at night. Elevation drains fluids from injured tissues. Elevate the injured area whenever you are sitting or lying down. Try to keep the injured area at or above the level of the heart.
Basic first aid to it. Treatment of sprains is simple. All you need to remember is a simple bowl of rice. Why rice? It stands for rest, ice, compression, and elevate. Rest the joint if you are in the middle of a workout. Stop putting pressure on the affected area. If you choose to ignore the sprain, you will risk permanent damage. Ice the affected area. Do this as soon as possible to help limit the swelling after an injury. Remember, do not apply ice directly onto your skin and try to wrap it with a towel first. Compress the affected area. A crepe bandage from your first aid kit will work very well for this. Elevate the